So let's explain both of them, and then we can sort of see how food changes them. Over here we have 4 hormones, 4 peripherally derived hormones. This one over here is called ghrelin, and it comes from the stomach. And ghrelin is the hunger hormone. Ghrelin comes from your stomach. When your stomach is empty, ghrelin goes up, tells your brain, I'm hungry. You eat, ghrelin goes down, and that is the end of hunger. It's an elementary, short-term hormone that signifies hunger and the end of hunger. Second hormone, peptide YY3-36. This is a hormone that comes from the end of your small intestine. This hormone, when released into the bloodstream, goes to your brain, same area of the brain, says, that's it, I'm done, finished, I won't eat another bite. You can't make me eat anymore. This is the satiety signal. So we have the hunger signal coming from the stomach, and we have the satiety signal coming from the intestine. And these 2 hormones control the meal-to-meal effects of food intake. But these are not the long-term effects. The long-term effects are mediated by these 2 hormones here, leptin and insulin. So leptin comes from your fat cell, goes to the brain and says to the brain, hey, I've got enough energy on board so I can engage in normal, expensive metabolic processes. I can eat a normal amount, burn it by doing exercise, go through puberty, go through pregnancy, because my brain knows that I have enough energy to engage in these processes. Now, when your leptin levels fall, that means your fat cells are smaller. And when your fat cells are smaller, that's telling your brain via the leptin level, hey, I'm in negative energy balance. Instead of having a surfeit of energy, I now have a dearth of energy. I am starving. And so the lack of leptin, the lowering of leptin, tells your brain, I'm starving, and I need to eat more. So then 2 things happen. One is the sympathetic nervous system over here gets suppressed, and that reduces the amount of fat that comes out. That leads to energy conservation, and that also leads to reduction in exercise, because you're trying to conserve, you're not trying to expend. In addition, from there, you end up with an activation of the parasympathetic or the vagus nerve, which is your energy storage nerve, and that sends a message down to your pancreas to release this hormone over here. We're going to talk a lot about this one, called insulin. Now, insulin is the energy storage hormone. Insulin drives whatever you've eaten into fat for storage. So when your leptin levels go down, your brain thinks it's starving, you will burn less, sit on the couch, and eat more, because you want to replenish the leptin level back to baseline. And so you get hungry and you get slothy. So these 2 behaviors, gluttony and sloth, that we normally associate with obesity are actually being driven by whether the brain can sense the leptin signal or not. And so the way you should think about obesity is that it is brain starvation, irrespective of what's happening in the body. If your brain thinks you're starving, you're going to eat more and exercise less. And this is what is happening in all obese patients. Now, let's talk about insulin. Insulin's really cool because it comes from the pancreas, and it tells the fat cell one thing. It says, store the energy. Whatever you're not burning right now, it's going into fat cells to store for a rainy day. It's your rainy day energy storage hormone, if you will. But normally what your insulin does is it tells your brain something else. It says, hey, I'm in the middle of metabolizing a meal. I don't need any more. Let me work on what I already got. And so it's actually part of the satiety signal. So when your insulin's working right, it tells your fat cells store, and it tells your brain stop. 2 dichotomous effects. But when it's not working right, that's when things go haywire. And that's what I'm going to show you next. So how do all these pathways fit together within the brain, including that addiction part that we talked about earlier? So here's the nucleus accumbens. Here's the hypothalamus. Now, normally leptin tells the hypothalamus, I've eaten enough, and so I don't need to eat any more. That then tells the nucleus accumbens to extinguish reward. I'm not looking for the sticky toffee pudding. I'm done. In addition, you've got the ventral tegmental area, that's where the dopamine paracarrier are, and it tells the nucleus accumbens, hey, I also don't really need to see anymore because leptin's working. So when leptin's working, it's telling the reward center to calm down, and it's telling the hypothalamus, I've eaten enough. So leptin signaling in the brain stops both hunger and reward. But when leptin's not working, you're hungry and you need more reward. In addition, you have all these other areas that we talked about that have to do with memory, with fear, with decision-making, that also impact on the need to continue to eat. In other words, the comfort food, the eating for stress, if you will, the binge eating that we talked about earlier. So, hunger, reward, stress. 3 separate reasons to eat. And every obese patient has a problem in at least one of them, and possibly 2 or 3. And trying to treat obesity is by determining and parsing which pathway has the problem. And this is what we do in our clinic at UCSF every day, is determine which patient has which problem and direct therapy to that specific pathway. And that is why we are successful. But eating less, exercising more isn't going to work because you can't solve these individual problems with that paradigm. So now we get to the question of food. And how does food impact on these pathways? Now, we're all eating more. I know we're all eating more. Of course we're all eating more. Okay? The data suggests that adult men in America are eating 187 calories a day more than 25 years ago. Adult women are eating 335 calories a day more than 25 years ago. And in this slide, teen boys are eating 275 calories more than 25 years ago. We're all eating more. And so you could say, well, duh, that's the answer to the obesity epidemic. We're all eating more. Therefore, it's our fault. And that, of course, is what the food industry will tell you. And they would tell you, well, just go exercise it off, because that absolves them of culpability. This is not true. Let me explain why. Yes, we are all eating more. The question is why? Why are we all eating more? And how did we all eat more all at the same time? And why is this true in places that don't even have enough food, like Bangladesh and India and, you know, the continent of Africa? Every country in the entire world has seen an uptick in obesity in the last 10 years. Did all of a sudden we all become a bunch of gluttons and sloths all at the same time? This is ridiculous. Not possible. So in order to understand, you have to understand this pathway and how it works. So the best way to try to explain how this works is with this paradox that I'm about to show you. So who here has children? Most of you. What happens when you give a 5-year-old kid a cookie? They bounce off walls. It's known as the sugar high. Okay? And all the kindergarten teachers know that the birthday cupcakes come out at the end of the lesson, not at the middle of the lesson, because once the cupcakes come out, that's the end of the lesson. Right? You all know this. The sugar high, right? And the kids bounce off walls and they get absolutely crazy. And there are truly behavioral constructs, which I'm sure Alex will talk about later to explain that. So what happens? Well, the cookie has fat and carbohydrate and sugar, and it drives energy into adipocytes. The adipocytes generate leptin. The leptin goes to the hypothalamus, and the hypothalamus now senses that the leptin's gone up. And just like a servo mechanism, it needs to then expend what it took in order to keep you weight stable. And so what happens is it increases the sympathetic nervous system, the fight or flight part of the nervous system, the part where your muscles get innervated in order to expend that energy, which they now have turned into fidgeting. Okay, this is fidgeting over here, the sympathetic tone. And what that does is it causes energy loss, and so the adipocyte then shrinks back. And so this is a very nice negative feedback yin-yang pathway controlling body weight via leptin and the sympathetic nervous system to keep you in energy balance. This is when everything's working right. So far, so good? So the paradox. What happens if you give an obese 5-year-old kid a cookie?
No sugar high.
Sorry?
No sugar high.
No sugar what?
High.
No, I don't think so. Anybody know? They're in the pantry looking for more cookies. Anybody ever see a sugar high in an obese kid? Doesn't exist. Never saw one. Not ever. Okay, I take care of obese kids all the time. No obese kid demonstrates a sugar high. Why? You already know the answer. Because their leptin's not working. If their leptin were working, they wouldn't be obese. So they add more energy to their fat cells and their leptin goes up, but their brain can't sense it anyway. And so they don't generate that sympathetic tone. They don't generate that fidgeting. They don't generate that sugar high. And how do we know that? Well, this is what's going on in the brain. This is in rats now. And you can add leptin, and you can see that the signal transduction mechanism goes way high, as it should. Okay? And you can see this is the increase in that pathway of leptin signaling, and that's good. But if you knock down the leptin receptor, that is, you prevent the leptin from working, now what happens is the animal consumes what? Sucrose, sugar. So when the brain can't see its leptin, whether it be pharmacologic in this case or physiologic in the case of obese kids, they want more sugar. That's the way they deal with not being able to see their leptin. So obese kids are sugarholics because it's the lack of leptin signaling is driving them to do so.